Hello and welcome to this short training video on how to correctly prescribe an outpatient prescription from the emergency department. My name is Nivi and I'm the one of the EPMA pharmacists within the trust. So in the first instance, you're going to be in the patient record on the ED view, which you can access through the blue menu bar on the left. Within the ED view, you have multiple M pages. The M page you need for prescribing outpatient orders or prescriptions are the quick orders M page. So within the quick orders M page, you have different subfolders which contain medications or other common orders in the system. So for outpatient prescriptions, the folder that you require is the ED TTO medication folder. I advise that before you do any prescribing, you ensure that you're in emergency encounter. So up here where it says emergency with the date of admission, make sure that says emergency, because if it says inpatient, what the system will try to do is get you to prescribe an inpatient TTO workflow, and it won't fire an outpatient prescription to the outpatient pharmacy if you're not in an emergency encounter. So within the ED TTO medication folder, you've got access to the common orders that are prescribed from an ED setting. If you require a medication to go home with that isn't in the folder, I will show you how to add that in a second. So in the first instance, let's choose amoxicillin 500 milligrams capsule 3 times a day with a duration of 7 days. If the dose, route, or form, or the frequency, or the duration don't match what you require, you can always edit it after adding it to the orders for signature basket. So I'm just going to click on amoxicillin, which then adds it to this basket up here for orders for signature. At the same time, you can add multiple different orders in one single go. So you can click on multiple different orders. So I'm going to add, for example, add this chloramphenicol. So you can see the numbers increase to 2 now. And then I want to prescribe a controlled drug for the patient to go home with, so I can demonstrate the controlled drug process to you. So if you're prescribing a medication that doesn't sit within the ED TTO medication folder, i.e. tramadol, you need to go to Discharge Meds as RX within this Request and Care Plan section. So make sure you toggle to the Discharge Meds as RX tab, because if you don't do this and leave it on inpatient, what it will do is add a drug to the inpatient drug chart rather than adding it as a outpatient prescription order. So toggle to Discharge Meds as RX and search for the drug that you require, and you can use this principle for prescribing anything that's not within the ED TTO medication subfolder. So I've searched for tramadol and selected an appropriate order sentence, as we call it, when it's got pre-filled dosing instructions. And that's now gone to the orders for signature basket. So I've got 3 orders in there. So now I'm going to click on that, and you can see that I've got amoxicillin, chloramphenicol, and tramadol. Say, for example, I accidentally clicked on some orders that I didn't want. You can always remove it from here. So I'm just going to remove the chloramphenicol because I only want my patient to go home with amoxicillin and tramadol.